So with that, I wrote a book called The Lyme Solution. If you want more details, it's all in there. This is all of my information, and I will leave that up now for our last 50 minutes to open up for questions.
Great. Thank you so much, Dr. Ingels. That was a very thorough presentation. So we're going to begin the Q&A portion of the presentation. If anybody would like to ask a question of Dr. Ingels, you can raise your hand in Zoom. Instructions will be put into the chat if you're not familiar with how to do so. And so why has it become so prevalent over the last few decades? When I think we're probably somewhere around the same age. When we were growing up, it wasn't really so much of a thing, and now it seems to be a major fear of people. If you go into the woods, I think everyone's scared that they're going to have Lyme, disease.
Exactly.
Just by going into the woods. Why has it become so prevalent?
That's a great question. I think it's twofold. I think the first step is kind of mentioned, I think with climate change, the things that were natural predators for ticks, a lot of that's changed. The tick population has exploded from the time you and I were kids. So there's more risk of exposure. But beyond that, I think the fact that our environment's more toxic, that we as humans are not as healthy as we were 40, 50 years ago. We've got this sort of toxicity issue that's affecting everyone. And the more toxic you are, the harder it is for your body to function well, the harder it is for your immune system to adapt. So again, I think this is where we come back to that idea of terrain theory, that our terrain has changed so much that our ability to adapt to the organism is compromised. And again, I really think this is an opportunistic infection. I think if you are a healthy person, if you get Lyme disease, you might get the acute symptoms. You would treat it early and you would be done. But for the people who end up with this long-term effect, again, I would argue there's something in the terrain, there's something that hasn't been addressed that's allowing that organism to become more prolific.
So based on that, how do we make you spoke a lot about like what we should do lifestyle wise if we, have Lyme, but how do we make sure that we have a healthy terrain to avoid getting Lyme, or if we get if a tick bites us and they have the proper bacteria, then we're going to get Lyme disease no matter what?
Well, I mean, how do we stay healthy as, in general? I mean, again, I think the cornerstone of that is diet and lifestyle. Do you eat the right foods? Are you eating organic foods? Are you eating junk food or processed food? Do you eat, grass-fed beef, or do you buy the stuff from McDonald's? That's a big part of it, because that's influencing our gut microbiome. And our gut microbiome is involved in everything. It's involved in our metabolism. It's involved in our immune system. So first and foremost, I think it's really about diet, and then beyond that, do you sleep a normal sleep pattern? Are you the person that stays up till 3 a.m. gaming or on your phone scrolling, and you're only getting really, 4 or 5 hours of sleep, where, we as humans need anywhere from 7 to 10 hours of sleep? So it's all these little factors that I think have changed over the last certainly 20, 30 years. Our lifestyles have changed. I mean, as a kid growing up, I had a stay-at-home mom. She made fresh food for all of our meals. We rarely ate out. I mean, that was a treat. And nowadays, you've got 2 working parents often, and there's not time to sit down and spend an hour plus making a healthy meal. It's easy to go get something that's fast. And I think, that kind of combination of, what we're eating, and certainly here in the US, I mean, unfortunately, the standards for food in the United States are very different than the EU and other parts of the world, where things are allowed to be used here that are illegal in other parts of the world. So the quality of our food has changed a lot. But, if we're doing the right things, if we're really feeding ourselves the way we should, we're moving our bodies as designed, we're getting good sleep, we're learning how to manage our stress, that keeps our immune system functioning the way that it's supposed to. It's kind of hard from the toxin standpoint, because there's a lot of things we can't control. But for the things you can control, again, if you're not using all the toxic stuff in your home, on your body, you're reducing your indoor exposure. It makes you more resilient to all the stuff you can't control. So, you do the little things that you can. Go for that low hanging fruit that are things that you have within your control. And for people, I think, who do that on a regular basis, and again, truly make it part of your lifestyle, these are the folks that are going to be less likely to have long-term effects, really from any chronic illness.
So I think it's very common, and you talked about doxycycline in your talk, and it's very common to be prescribed doxycycline as a to prevent getting Lyme disease right in the beginning, like you do just a few days, a few
Yeah.
days of it, and it's supposed to prevent you from even being able to get that. I know that you're not necessarily a fan of that, but what should a person who fears they may have been exposed to Lyme disease do to minimize the risk of them getting full-blown Lyme disease?
Well, in terms of true prevention, I mean, one of the things you can do, there's actually research showing that if you get something called permethrin itself is actually very toxic when it's wet. However, if you take, whatever your shoes and socks that you're going to use when you're outdoors, particularly if you live in an area that's endemic for ticks, spray the shoes and socks with permethrin outside. Make sure your gloves and a mask protect yourself. Once it's dry, it's actually very safe. But when you use permethrin on your shoes and socks, it reduces your risk of a tick bite by more than 70%. That's huge. So, even something as simple as that can reduce your risk of getting a tick bite, because most of it comes up through your feet. You're walking on grass, you're walking through foliage. That's where most ticks are getting on your body versus, you brushed up against your hair on a tree branch and it ticked on that way. There's other things you can do in and around the house. There's things called tick tubes. You can make your own tick tubes out of an old toilet paper roll, or you can go buy them. Basically, the ticks get trapped inside and get stuck, and you can put those in and around your yard to try and protect your yard. That's probably the best way. And if you do, I hate for people not to enjoy being outdoors. I think being in nature is so important. And I appreciate the healthy fear of not wanting to get Lyme and get bit by a tick. But, if you're going to be outdoors and as a family, when you get home, do tick checks, check each other. If you got kids, strip the kids down, look at all the cracks and crevices. And so by doing tick checks, doing the permethrin, wearing long clothing, particularly if you're going to go hiking in the woods, you're going to go camping. Again, clothing is a protective barrier against that. And there's some great essential oil products that you can spray on your clothes, spray on your skin before you go out that are natural tick repellents. So between all that, that's probably the best way to help reduce the risk. For people who do get exposed, again, if you do pull a tick off yourself, if you ever pull a tick off, save the tick. You can send the tick in. I mentioned tickreport.com, but there's other labs that you can send the tick in, have the tick tested. And if it's a deer tick, or if symptoms start early, you want to get treatment right away. So I'm not opposed to antibiotics at all. I think that's very appropriate. But the idea that one dose of doxycycline is going to work, that's never been shown to be true. If you're going to do it at that point, you're going to do at least the 3-week course until you at least get tested to see if you made antibodies, or at least till you get your tick back and see, did the tick carry anything? So you do want to start early treatment as much as possible. But again, I think that's where antibiotics are actually very appropriate. But the CDC's guidelines, again, I think are a little misguided.
So there's an idea out there that if you're bit by a tick and you get it off within 24 hours, you don't need to worry about Lyme disease. Is there any truth to that?
No, that's unfortunately not true. And even if that was true for Lyme, it's definitely not true for a lot of the co-infections. You can get rickettsia, Bartonella anaplasma in a matter of minutes. So this idea that the tick has to be attached for a certain time frame, we don't really know what that time frame is. I think that there was one study, wasn't that long ago, I think they found that within 6 hours of it being attached, it had transmitted Lyme. But we know other infections get transmitted much faster.
And how does the tick get on people, right? Does it crawl up the shoes? You mentioned getting on your hat, but they seems like they get everywhere on the body. But is there like a point on the body where it starts?
It depends on where the tick is and relative to where you make contact. So again, the feet are common because you were walking through grass, you were walking through. Ticks don't jump. They have to be like right next to you to crawl on you. So that's why I said if you're wearing boots when you go hiking, wear long pants, the likelihood of a tick being able to get through to you, to your skin, to bite you goes way, way down. But for people who go out in flip-flops, bare feet, shorts, And again, theoretically, like if you were walking through a path and your arm brushed against some foliage, your head hit a tree branch, if there was a tick on that tree branch, that would be enough that it could, the ticks kind of know when you're close and they can crawl on you very quickly, but they can't jump. So that transfer can be relatively brief. But yeah, you got to have a direct contact with wherever that tick happens to be, you know, nesting to actually get on your body.
And is Lyme disease deadly?
Unfortunately, it can be. Now, in saying that, rarely, very, very rarely. That is an extreme consequence. There are people who have died of Lyme disease, but it's extraordinarily rare. In my 25 years of doing this, I am only aware of 2 people who are known to have died from Lyme.
Thank you. I'm going to open up to the audience.
Hey,
DA,
Carolyn.
come and ask your question. DA?
Hello?
Yes, please stay with
Okay,
your-
great. Thank you so much. First of all, thank you so much for your presentation. I really appreciate it. Back in May of 2023, I used the modified Cowden protocol, and that also included biocidin and
Yep.
golden seal and grapefruit seed extract. I did it for a period of 3 months. So my first question is, should I again get retested for Lyme, and if so, how? Or should I just call it a day? I had a tick exposure probably in the early 90s. I took deoxycycline and then I ignored whatever. I think the only long-term symptoms I may have had was hypothyroidism and diarrhea, probably because of the diocycline.
Yeah.
So that's my first question. The second is spinal tap fluid. I was rushed to the hospital for something totally unrelated, and they did a spinal tap. This was after 2023. This was recent. And they said I had absolutely no Lyme disease. I don't know if that's a definitive test or not. I was told by one naturopathic doctor that's only under conventional. It still could be buried, I guess, in the biofilm. And then finally, when you treat Lyme disease, do you also test and treat parasites at the same time? And if so, how? Thank you.
And you've got
Okay.
3 minutes to answer all of that.
I'm sorry, I just had those 3. They were important. Sorry about that.
Sure, no,
Well, I'll answer the spinal tap question first. That's the easiest. So spinal fluid, unfortunately, even if you had neuroborreliosis, the likelihood of picking up spinal fluid is extremely low. It's very hard to detect in spinal fluid. So a negative spinal fluid for Lyme would mean absolutely nothing, even if you had acute Lyme. It wouldn't rule out the possibility. Your first question about the herbs. So in terms of retesting, I almost never retest people. You can have Lyme antibodies for up to 20 years after exposure, even if you've been treated. So ultimately, treatment is gauged on how you feel. If clinically you don't have any symptoms, then you're good. I mean, it's where people are still symptomatic. Now, I expect antibodies like for Bartonella, Babesia, I expect them to go away at some point. Don't expect Lyme antibodies to go away. In fact, I've seen people that have IgG antibodies. They have no symptoms every time they get retested for whatever reason. So don't use the labs as a marker on how you're doing. It's really the way you clinically feel. That's the most important. And then your third question was, I'm sorry, what was your third question again?
Oh, give me 1 second.
Parasites, testing and treating parasites at the same time.
Yeah.
And if so, how do you test and treat those
So
parasites?
my background is I was a clinical microbiologist before I was a doctor, and I was a parasitologist. And I can tell you, despite what's in popular media and influencers, parasites are almost never the problem. That might be an unpopular opinion here, but I tell you, I've looked at thousands and thousands and thousands of samples as a clinical microbiologist. And with the technology now between us, understand most of the parasites in your body are in the intestinal tract. Rarely do they migrate outside of that. So with what we have now with PCR testing, trichrome staining, the new technology, if there's a parasite there, there's a good chance we'll pick it up. This idea that parasites hide and you can't find them, it's just not true. And people with true parasite illness tend to have a lot of gastrointestinal symptoms. So this idea that they migrate to your brain and do all that, again, that's an extraordinarily rare circumstance. So this idea that parasites are the big problem, it's just not true. Now, I've had people who go through different parasite treatments and they say, oh my gosh, I felt so much better. I'm like, okay, but the stuff you took wasn't specific to parasites. You know, anaerobic bacteria is a big chunk of your gut microbiome that we can't measure unless you are in a hospital. You can't measure anaerobic bacteria. There's no stool test in the world that does that. And a lot of stuff that we use to treat parasites do treat anaerobic bacteria. So if you had an anaerobic bacterial overgrowth or dysbiosis, those things might help. But unless you have actual evidence of a parasite, I wouldn't treat it. Plus, in a lot of anti-parasitic stuff, even with the herbs, part of the way you get rid of a parasite is you purge it. So a lot of the herbs like Juglans nigra, black walnut, a lot of these things are purgatives. They're designed to irritate your bowel so that you actually start pooping it out. And I don't want to irritate a bowel of someone who doesn't need it. They have a healthier bowel, and now we're putting them on a parasite treatment because some influencer said, "Oh, you're loaded with parasites." I mean, it's nonsense, and I wouldn't do it.
Great. So we're out of time. So thank you so much for all of that information. It's much appreciated. If we can unmute the audience so they can share their appreciation for the doctor.
Thank you.
Like when he had his car there.
Thank
Was the only one who
you.
asked
No
a
question.
question.
Thank you.
Thank you.